Majority of women, when they feel a mass in their breast, or there is nipple discharge, or there is abnormality in their breast, they become very anxious. And they really want the answer yesterday. You know, women are the gatekeeper. The entire family really become anxious and uncomfortable. So we are not providing a service to the patient, we are providing the service to the family by letting them know much earlier. Going to the physicians and doing biopsy and understanding what is the nature of that disease takes at least from 1 to 4 weeks. And this is a very long period of time for a woman to feel that, what if I have breast cancer? Since 1984, when I came to UF here in Jacksonville, I brought the procedure of what we call fine needle aspiration biopsy. And that is practically insertion of a very small bore needle in the area where abnormality is detected, take some samples from that lesion and look it under microscope. In at least 85 to 95% of the cases, we have the capability of looking at the slides, try to make a preliminary diagnosis of what the case is. So this is an accelerated, or what we call it, rapid assessment breast clinic. We have practiced this since 1984 in this community. And we have been fortunate to really bring our surgeons and our breast imagers together so that this will be a sort of a teamwork effort between what we do and what the patient needs after we diagnose. What we are offering, that you wake up in the morning, you're taking a shower, and then you feel a lump, and you don't know what it is. And you want to know quickly. We have that ability that this patient can call my office, and based on the availability, we'll be able to see that patient the same day. And then we examine the patient, and then we have the fine needle aspiration biopsy that we can use to try to sample the lesion and try to look at it and see whether it's a benign process or malignant. So the time saved in the process of referring to multiple people and try to see what it is, it becomes reduced to just come to one stop, one place, one person, and then try to get the diagnosis and then get the follow-up management. Because this doesn't stop by just doing fine needle and tell the patient what it is. We have that responsibility to make sure that we coordinate our services in a way that the patient is going to be followed very quickly. The beauty of what we have is the fact that this service can be offered in multiple locations. If a patient needs to go to Northside, that is available. If they want to go to Main Hospital at 8th Street, we are also available to do that. Therefore, we do our best to make sure that we accommodate the patients.